Hey guys, Ralph Havens here, physical therapist at Bellingham, Washington, Beyond Limits with Ralph Havens, Beyond Limits Physical Therapy. And I've got a really cool set of strain, counterstrain positions to relieve tension around your ankles and feet. If you're dealing with old ankle sprains, if you're dealing with pain, there's something that can be done to help called bone bruise technique. That's beyond the scope of this video. It's something I can do for you. But if you do have knee pain or ankle pain that's not resolving, it very likely could be a bone bruise. Give me a call. I'm at ralphhavens.com and or ralph@ralphhavens.com, and find me, and I can walk you through the bone bruise idea and how to fix that up. So here goes. This is a technique for ankles, and it's a little complicated, but if you follow along, you can do it. Every position is 1.5 minute technique. So you put your foot to start with just on the couch, and I'm going to take my hands and I'm going to push on this big bump, the medial malleoli, and then the lateral bump, I'm going to go just a little south of that and push just lateral to it, so or just south of it. So the lower bump, the lateral bump, I'm going to push right there, and I'm going to do it with my two fingers like this. So it's a little complicated. I hope you guys can get this. Message me if you can't. And so I'm going to just push my fingers together. So the top thumbs are pushing down on that bone. The two middle fingers together are just below the lateral bump. Those two fingers are pushing up towards the ceiling. And now I'm going to just hold this position for 1.5 minutes. And like we said in some of the other videos, it resets the muscle spindle. It helps with the autonomic nervous system, and it helps take tension out of the ankle. So what happens with ankle sprains is you can be a little off center. The joint can be a little askew. And when that happens, it rubs a little bit too much, and it can cause pain, it can cause bone bruising. If you have an ankle sprain months and years ago and yet you're still having problems with your ankle, it very likely could be the joint is just a little off center, and you're dealing with some bone bruising. And so this can help restore the balance to the ankle. And this is, if you're going to do just one of these ankle techniques, I'm going to show you 4. If you're going to do just one, do this one. It's for the medial ankle. We've got another 30 seconds to go. I'm going to walk you through all of them with the left foot, and then I'm going to do it again with the right foot, just so that if it's difficult figuring out flipping feet, you could just use this video over and over again and have a really good effect. If I'm dealing with a little tension or pain in my legs, a lot of times I'll do these 4 positions for each foot the night before a big run. All right, so that's 1.5 minutes. And now the next one, just south of that little bump, the medial malleoli, I'm going to take this part of my hand and I'm going to just push it. And so I'm going to put it right on the edge of a bed, and I'm going to push straight down, not on the bump, but a little bit south. And I'm going to hold that down with about 1 pound of pressure, and I'm going to hold it for 1.5 minutes. So a little bit of a time thing for this video, but I want to do it for you with both feet so that it's a no-brainer and you can just use it. And like I said, a lot of times with chronic injuries, if you're a runner and you're not running because of pain, ankle pain, knee pain, hip pain, back pain, there's a reason for it. And that's been my quest, my job, my whole healing practice life, is to find what's causing this. Like why some people heal and why some people have lingering problems and then they maybe never run again, or they're limited with walking. And the key I found is your body is protecting you from something. In this case, it could be bones. It could be bone bruising, a very common phenomena. And there's an actual technique to fix up the bones, literally fix up the bones. There's techniques to fix up ligaments. There's techniques to restore joint mobility and the actual space inside a joint. So basically, we want to look at like, why is somebody still dealing with a problem? It could even be something far removed from the area. An ankle pain could be that the hip is a little off. The hip being a little off could be that something in the internal organs are a little off. You know, liver takes up a lot of space in the body. If it's got some problems and tightnesses around it, it can twist the body. And now your foot's landing on the ground differently. So the key is to find out, what is it your body's protecting you from? It could be an artery problem. You might be protecting a big artery around your heart, like it was for me years ago, and that was limiting me 8 months without being able to run because I was protecting an artery around my heart. The symptom, how I felt, was I was having a calf spasm that wouldn't go away for 8 months. Solving the problem with my heart made it so I could run. So this is the key to this type of physical therapy, this type of healing, this beyond limits healing with integrative manual therapy. So I've lost track of if we're at a minute or a minute and a half. I believe we're at a minute and a half. I'll go a little longer just to make sure. And I'll show you 2 more for this left foot, and then we'll do the right foot. I've been wanting to make this video for quite a while because it's something that you can do to yourself. And I see so many people with old ankle sprains and old knee injuries, and this can help. All right, so then you relax like that. Now the next one is you're going to take the heel of your hand, the opposite hand, and you're going to push on the heel bone. The calcaneus is going to push straight towards the floor, and you're going to take the other hand and grab that forefoot, and you're going to turn it as if you're trying to turn the bottom of the foot to face the ceiling. And then you hold that for a minute and a half, and you just hold it real still. Now the key is that the leg that's on the couch is relaxed. So you want to get yourself positioned on a couch where you're totally relaxed. We're going to go a little over another minute. It's been getting close to 30 seconds. I'm going to leave links in the description below also about the idea around this true healing method and protection, how you're protecting yourself from it. It's what I used many years ago. I'm 65 now. It's what I used many years ago to cure myself of anxiety. I no longer have what was a lifelong anxiety problem for the first 37 years of my life, and a very crazy sweaty hand problem. I used to have a very crazy sweaty hand problem, sweaty feet problem, and I don't have that anymore. And so what I've come to realize is if it can happen, it can unhappen. And if you're dealing with an injury, if you're dealing with a problem, some sort of health condition, there is an answer. If you haven't found your answer, it's just that you haven't found the right key. And the key is there's something that your body's protecting you from. And finding that and having the right technique or thing to do to solve it can lead to your healing. So reach out to me, Ralph at ralphhavens.com. Ralphhavens.com is the website. And I can do a free consult for you and let you know what I see that's going on for you. So we're coming up on a minute and a half, and then you just relaxed. Now this next one, you're going to take the thumb on the big bump, the medial malleoli, and you're going to hook your fingers around the calcaneus, the ankle bone, and you're going to bring your fingers together. So you're going to shear that joint like this. So see, I'm pushing down with the thumb, I'm pulling up with my fingers on the calcaneus, on the heel bone, and I'm going to take the hand on the forefoot, and this time I'm going to turn it as if I want to turn the foot. The left foot is counterclockwise. And so I'm turning the left foot towards the bottom of the foot towards the floor. And hold that for a minute and a half. And even though I'm in a contorted position, my leg is pretty relaxed. And that's the key, because we're turning down the nerve impulse that goes from this ankle to the spinal cord, and back from the spinal cord to the muscles and the joints and the ligaments. This restores balance in the joint. This improves mobility of the joint. You'll walk better after this. So we'll go a minute and a half, and then we'll do the other side. For those of you that don't need to see the other side and can figure out, you're welcome to just go do the other side. But I am going to show the other side because I know when things get flipped left versus right, it can be very confusing. Where do you put your hands? And I want to make sure you get this and use it. And feel free to share these. Even though a lot of the videos that I'm sharing are unlisted, because they're for one-on-one clients and they're for our group clients. Even so, I like to share them with people because the world can use some healing, and there's techniques that can help people heal. So feel free to share them. I'm okay with that. And if you know anyone that has a problem that's not being helped, not being fixed up, feel free to let them know about me and our healing here. I see people in Bellingham, Washington, in person, hands-on. and also over Zoom online with people from all over the world. We have one-on-one sessions, we have group sessions. My commitment is to help you have a way to heal. So now after a minute and a half, I'm going to go just a little longer to make sure. Then we're going to let go. And I encourage you to write in the comments like what you're dealing with, what you would like help with. Reach out to me at ralph@ralphevans.com and I can take a look for you and see what's going on. Okay, so now I'm going to relax. So that's the left foot. Now we're going to go through the right foot, a minute and a half per position, right? And first one is the thumbs on the bump, on the medial malleoli, the fingers, the middle fingers just below the lateral malleoli, just south of that. I squeeze my fingers together, so I'm shearing that joint, and I hold it for a minute and a half. And I invite you, if you like, while you do this, it can become a bit of a meditative experience. What you can do, if you like, is just bring some of your attention, your awareness into your own body, and just notice what you notice. There's a lot of power in that very profound way of being, is to notice what you notice. And to notice what you notice in your own body, and just to follow it. Just to say, okay, yeah, I'm noticing something here, and I'm noticing something there, and now it's doing this, and now it's doing that. If you take a little time while you do this and just notice what you notice, you can have a profound experience that can open up a lot of healing for you. So we got another 15 seconds for this first one. Okay, next one. Remember, you got this part of your hand, and you got the medial malleoli bump right on the edge of the couch. Just south of that, we're going to push that straight down towards the floor and hold that for a minute and a half. You're pushing about a pound of pressure. And just a reminder, look in the description, look in the comments. I'm going to put lots of links with lots of self-help treatment things. I'm making a video, hopefully the next few days, of all my running drills, which you can use for walking too. I have lots of very specific techniques and exercises and movements that I use before my runs, me and my family use before our runs, before our races. And it'd be great to use before your walks. Gets you very balanced and very good mobility as you go out and do your exercise. So, and they're healing in and of themselves. But I'll make those and look for those later. So we've got a little over a minute to go. A little over 30 seconds to go. Some of you might feel a little movement under your hands, like something's wiggling around in there. And what you do with your hands is you just keep them very still. And what's going on is your body is readjusting and rearranging and putting things in a better position. And so some of you with some manual therapy, palpation type skills might feel a lot of unwinding, a lot of the body going through a little self-corrective healing. And while you notice it, you want to not move your hands. So you don't want to follow it or try to move with it or stretch it or do anything to it. You just keep your hands very still with this pressure directed straight down towards the floor. Okay, so that's the second one. The next one is you take your heel of your hand and you push that calcaneus bone straight down, and you take your forefoot and you turn it so that the bottom of the foot is turning towards the ceiling, and you hold that for a minute and a half. Let me get a better position for that. Push straight down and turn. takes 1.5 minutes for this muscle spindle to reset, for the autonomic nervous system to reset, the spinal cord, the little nerves between the spinal cord and the ligaments and tendons and muscles. I find it way more effective than stretching. With stretching, we're trying to force something that's tight to let go, but your body in its wisdom is making it tight because it's protecting you from something. So instead of trying to force it to let go with a stretch or with somebody massaging it hard, we put it in positions of ease, and then the body resets itself. It's very safe, and it's much more effective in my opinion. We got another 30 seconds. What I'm feeling is my foot is doing a lot of little movements underneath there, and I'm keeping my hands very still. Feel free to share these videos. Look through the videos. I'll put some more in the comments. Look through the whole YouTube channel. There's probably something in there. If you're dealing with some sort of problem, some sort of condition, I've probably made a video for that. If you don't see something for your particular issue or problem, email me, ralph@ralphhavens.com, and let me know. And I will, if I haven't made one, I'll see if I can make one. If there's one that we can figure out how to do some of the things I do this healing work one-on-one with people in person here in Bellingham, Washington, and also online over Zoom. And some I can show you how to do it, and others I need to do it for you. So right, there's 1.5 minutes. Now the next one is you're going to let's see, how do we do this? We're going to take your hand and you're going to push on the medial malleoli, and then your fingers are going to cup around the heel bone, and you're going to push your fingers together. The bottom fingers go up, the thumb goes down, and you take your forefoot and you turn it clockwise. The right one goes clockwise, as if you're trying to put your bottom of your foot on the floor, and you hold that for 1.5 more minutes. So we have 1.5 more minutes to go. For those of you still watching and doing this, good job. When you think of it, it's not such a long time. 1.5 minutes times 4 per foot to restore balance and mobility to your feet and ankles. That's not bad. That's a pretty good use of time, I think. Share this with runners, share this with walkers. It's something that I can do for other people very easily, where you just lay on your side and I do this for you. But I did figure out how to do this on your own, so this is a great way to get some self-treatment. Again, look in the video description and comments for more links, because I'm going to just open up some of our treatment vault, stuff I use for one-on-one clients and group clients, and just put as much as I can in here. And if you use it, you could have body work for yourself every day a little bit, or take a few days a week and just spend 30 minutes and get some really good body work done. When you're done doing this technique on both feet, walk around and notice how your feet are on the ground. Notice what's different. And notice how the rest of your body feels. As you take tension out of this nervous system, you might feel more relaxed. You might, your shoulders might move better. You might feel taller. Your breathing might be different. So just notice what you notice, and then let us know. All right, you guys, this is Ralph Havens, physical therapist, integrative manual therapist here in Bellingham, Washington, Fairhaven area. And you can reach me at ralphhavens.com. You can also reach me at autoimmuneanswers.com. And my email is ralph@ralphhavens.com. All right, you guys, let's get out there and live, really live. Let me know how it's going, and I will see you in the next video.